More than half of the state's hospitals are operating at a loss or unsustainable margins because of the COVID-19 pandemic. That's according to a recent report commissioned by the California Hospital Association.
That means they are losing money every day caring for patients.
Jan Emerson Shea is Vice President of External Affairs for the California Hospital Association. She says more hospitals are losing money now compared to pre-pandemic.
It's probably going to take years for the situation to fully right itself. And in truth, there may be hospitals across the state that just aren't able to come out of this.
Inflation is only worsening the financial strain on hospitals. The report found that hospitals are generally caring for fewer patients, while costs are rising and labor shortages are growing. Hospitals have been turning to contract workers. It's an expense that's hurting their bottom line. Some travel nurses are being paid upwards of $300 an hour.
And California is not alone in this, so we're in a national bidding war, if you will, for these temporary workers.
Scripps Health is one of the largest hospital systems in San Diego. Its CEO, Chris Van Gorder, says Scripps has paid as much as $211 per hour for contract nurses. He says they currently have around 1,000 open positions.
And we're talking about everything from nurses to environmental service workers to food service workers.
Van Gorder says the worker shortage and rising expenses is taking a major bite out of the healthcare system's profits.
We're seeing supply costs going up about 5 to 6%, but our revenue growth at best is going to go up about 3%. So these very small margins you're seeing hospitals make right now are going to get even tighter in the next couple of years.
There's also another financial cloud hanging over hospitals. The Seismic Safety Act was amended 20 years ago. It requires hospitals to be retrofitted to operate after earthquakes. It has a fast approaching deadline of 2030.
That has a $100+ billion price tag associated with it. We're running into a train wreck if something isn't done to relieve the pressure on the seismic issue.
Emerson Shea hopes hospitals get a deadline extension.
There's probably not enough money in the state to pay for all of the seismic requirements, but we may need at some point to have a conversation about at least some dollars being allocated. But right now, time doesn't cost anything, and it could be an enormous help.
Over at Scripps, Van Gorder is budgeting for the seismic retrofitting mandate, something that could increase with the cost of raw materials.
We're hoping to get a delay on that, but the legislature is struggling with that. That's $2.4 billion for Scripps. Legislators will look at the balance sheet and go, well, why? You look at all that money you have in the bank. Well, I can tell you, if we spent all the money we have in the bank right now, I would not be able to comply with SB 1953.
Van Gorder says hospitals, including Scripps, got federal COVID relief money from the CARES Act and the American Rescue Plan, but he says that money is gone. He'd like to see some more help from the state or federal government.
We're lucky in San Diego. We've got good healthcare systems. We've got good, strong healthcare systems. I'm not saying Scripps is not in danger of closing. We have a balance sheet that can support us. But when you look forward to all these challenges that I have to deal with, and particularly the unfunded mandates, the $2.4 billion in building costs that I have to do because the state says I have to do it. Other states don't have that problem.
While Scripps or other San Diego systems may not be at risk of closing, the Hospital Association says it's a very real threat for others. They were lobbying for increases in Medi-Cal reimbursements to try and help struggling hospitals, but ultimately they weren't able to get it in the state budget. California is allocating money for health worker education and training. There's also $1 billion in stipends to help retain staff. Again, here's Emerson Shea.
We need all hospitals in this state. We have roughly 400 hospitals in California to treat 40 million people in our state. We cannot afford to lose these very important centers of care.
Matt Hoffman, KPBS News. Thanks so much for watching KPBS on YouTube. I'm health reporter Matt Hoffman. If you like what you saw and you want some more content, click that subscribe button.